Hello, welcome to Dr. Colbert's Divine Health YouTube and podcast. Today we are talking about a very important subject that is plaguing every one of us. Energy. Energy. Dr. Colbert, I'm tired all the time. I'm tired.
That's the number one complaint I hear.
I wake up in the morning. Number one complaint.
Number one.
After sleeping all day, I get out of bed and I'm still just tired. We got to give these people some real answers
now,
to
again,
help.
those people that are bone tired when they get out of bed, many times they have sleep apnea. And now, if you have an Apple Watch, you can usually detect sleep apnea on your Apple Watch.
Really?
And we'll be talking about that. That's a major cause of severe fatigue, and men, if your neck is 17 inches or bigger, you most likely have sleep apnea. And women, if your neck is 16 inches or greater, you most likely have it. As we age, the risk of sleep apnea increases. And so again, this is one of the main triggers because it usually occurs in overweight or obese patients, especially in men over 40.
Okay, so what is it? That little palate in the back drops down and gets lazy?
What happens is, as we age, everything starts to sag and our soft palate sags.
Unfortunately, that's true.
Then if you sleep on your back, that soft palate will sag like a sagging curtain and will block your breathing passages. And so people start gasping for air, or they stop breathing for 10 seconds or longer sometimes. And then they wake up with a dry mouth and they wake up bone tired. Here's what happens when you have sleep apnea. You're also at an increased risk of high blood pressure, atrial fibrillation, severe fatigue, dementia, type 2 diabetes, cancer, and heart disease. But one of the worst things is severe fatigue. These people are exhausted.
Yeah, I know. When they come in as a patient to see you,
I can tell immediately.
The first thing you do is let me open your mouth. So when someone's overweight, it causes that
to sag. Yeah, and so many times just losing.
So they could be 30 years old and have that.
Most of the time, losing 20, 25 pounds is enough to correct it if it's mild.
Wow.
25 pounds. That's it. It's so easy. So that's a major cause of severe fatigue that I see almost every day in my practice.
Wow.
But we're talking about, first of all, fatigue, and we want to kind of, identify some terms. Adrenal fatigue. You hear a lot of people talking about adrenal fatigue. So let's define adrenal fatigue, Mary. Adrenal fatigue is a term used by alternative medicine doctors to explain fatigue and other symptoms thought to be due to exposure to stressful situations. It's presently not a recognized medical diagnosis. And a lot of alternative doctors, chiropractors, nutritionists use this. Adrenal fatigue is when chronic stress and insomnia and anxiety drain the adrenal glands and leads to a low cortisol state. Now, this is adrenal fatigue, and I would say probably 90 to 95% of my patients have adrenal fatigue. Now, Addison's disease, on the other hand, is adrenal insufficiency, and that's where cortisol levels are extremely low, and to diagnose it is diagnosed by the ACTH stimulation test with cortisol measurements at 0, 30, and 60 minutes. And this affects only 1 in 100,000 patients. I've only had one patient in 40 years that's had it. So most people with adrenal fatigue do not have Addison's disease. My patients on Addison's disease had to take hydrocortisone, and they had to take Florinef, which was aldosterone, and they had to take in a lot of salt every day to bring their adrenal function up to normal. So again, this is extremely rare. And the most common cause of Addison's disease or extreme adrenal insufficiency is simply due to autoimmune disease affecting the adrenal glands. And it used to be due to infection like TB, but now it's extremely rare. So most people with fatigue have not Addison's, but simply just adrenal fatigue, which is an alternative medicine term, okay?
And what's so amazing, Don, is through the years I have watched medical science kind of catch up to what you have been doing with your patients for years.
Right.
Because I remember back when you were trying to address adrenal fatigue with people, and if they would go back like to their primary care and mention it to that doctor, that doctor's wrong. He's crazy.
They say Addison's.
That's not adrenal fatigue, And that's because they were
Right. Adrenal fatigue is simply a low cortisol state where your cortisol and your DHEAS or DHEA sulfate level and pregnenolone level are generally low normal. Whereas Addison's disease or adrenal insufficiency is where you don't produce hardly any cortisol. Your DHEA is extremely low as your pregnenolone level is low and your aldosterone level is low. So again, it's totally different. But it's kind of like thyroid. So many of my patients they don't have hypothyroid or low thyroid. They have just simply a sluggish thyroid. But they do so well with just a little non-desiccated thyroid, natural thyroid. Put them on little low doses in the morning like you and I take. And it's amazing how it helps our metabolic rate. It's amazing. Similar to low cortisol levels or adrenal fatigue, I put them on an adrenal rebuilder like our adrenal booster. And this is a new product we have, but we have others we've used. I've been using adrenal boosters for 30 years on patients. I've been on them for years. You had to be on it because you got so tired. You were so fatigued. I had to put you on a testosterone pellet, and I still do it every 3 months. And I put you on adrenal desiccated by standard process years ago. And literally, you would get so tired. I'd say, you said, something's wrong with me. You want to tell your story of how you said, Don, something major's wrong with me.
You know, I remember one morning getting up with him because I've always been the energy bunny. Just tons of energy.
You'd wake up fully charged.
Full of charge, running with the kids, the grandkids, playing with them.
Around the house.
And just going. And I just remember, you know, after a few days, after a week or so, nothing. It wasn't recharging. I wasn't coming back.
You're sleeping. You were waking up exhausted.
Yeah, and I told Don, I said, Don, no, I think something's seriously wrong with me. I think I'm dying.
I said, Mary, let me check your adrenals. We have a way to check it.
He goes, I know what's wrong with you. Because, I mean, he sees my life. He knows.
Right.
He's the dumper. He dumps it on me to take care of.
Stress. She's the stress receiver. I'm the dumper.
Stress receiver. He dumps it on me. And he knew that. So he goes, I know what's wrong with you. You've got adrenal fatigue. Now, if someone is abusing, let me just say this, because this thought came to me, and I know when that happens, it's not just me. If you're somebody that you do cocaine, you're smoking pot,
Adderall,
you're doing Adderall, you're doing all kinds of stimulant drugs,
caffeine junkies.
You're drinking that energy, 5-hour energy all the time and constantly. Let me tell you something. You're depleting your body of its natural ability to heal.
Yes. You're draining your adrenals.
That's what you're doing.
There are foods that do the same. I'm going to be talking about later.
I want you to imagine what you're doing to your adrenals when you do this on a constant basis and you're not allowing your body to heal. It's like having an open wound in your arm, and just before it closes, you rip it back open.
Pull the scab off.
You pull the scab off, and you're pulling that wound right back open. That's what you're doing to your adrenals when you do these drugs and
caffeine.
Listen, God designed us
Red Bull
to operate with natural things to heal your body, to restore your body. That's his best.
Absolutely.
Is to work with the natural. And that's what we want to talk to you about today. So I hope you hear what I'm saying.
Now, adrenal rebuilders, and we're talking about adrenal fatigue, and so many people, first, if you're going to restore your adrenals and overcome fatigue, you've got to stop the worry and learn to cast every one of your cares. Number 2, you've got to start sleeping good. You got to start getting good night's sleep. We're going to be talking about that in a minute. And number 3, most people need an adrenal rebuilder. One of the best adrenal rebuilders I've ever seen is bioidentical testosterone. And again, we use this in creams. For men, if you're like younger than 55, we have the testosterone zone here. You take 3 in the morning, and it's amazing how it restores testosterone levels with natural supplements. We use Testofen, which is fenugreek, as well as long jack, as long as boron, and key herbs and nutrients like ashwagandha, KSM 66. And it is amazing how many of my men feel so much better taking the testosterone zone just 3 in the morning. Now, also, if you're over 55, usually men and women, testosterone is amazing in restoring the adrenal glands. I personally take just a low dose of the testosterone injection, 0.4 ml. IM once a week in my thigh. You don't want to put it in your buttocks. It causes high estrogen. I take my DIM, which is in my hormone zone, twice a day, which lowers estrogen,
Now,
or
you
else it'll
said
shoot
that-
your estrogen up.
You said that real fast, but that's
Okay.
an important thing.
Oh,
Don.
yeah, but
Yeah, that
I
men
talk
who-
about all this in my hormone zone book, Mary.
if you take testosterone in a shot in your rear as a man,
Yes,
you'll
it can-
increase your estrogen.
It can increase your estrogen. This is what
Shit.
most doctors had you give it your bottom, where the fat is.
No.
And then your estrogen shoots up, and then you're wanting to watch TV and all these feminine TV
developing
shows, breasts.
breasts
And
like
you
women.
wonder
no.
why you're crying all the time. I see this every day in my office, Mary. But testosterone
That was an
is,
important point.
I know, but testosterone is the best adrenal rebuilder I've ever found for men and women. Women, let me tell you, the normal testosterone for women at age 20 to 30, according to the LabCorp, is 15 to 71 nanograms per deciliter. Now, a lot of my young women that are in their 20s, their testosterone level is around 70. They feel amazing. They have boundless energy.
That's
they
their
never
libido too.
Oh,
Gives them high
amazing.
libido.
Oh, yes. And again, what I found for most of my women, I try and get my women over 50, their testosterone level to right in that magic zone, 70, 75 or a little higher. And all of a sudden they feel just like a young 20-year-old. And it is amazing how it restores their energy. Testosterone is the best
We
for
have
men and
just
women.
answered a lot of people's questions with ladies. If your libido is in the toilet, you're probably your testosterone.
If you're fatigued, your
Yeah.
testosterone women is in the toilet. I guarantee
You need to get a blood test and get that
Yeah.
checked.
Now, again, what I do is I use just natural creams, or I use sublingual troches or oral dissolvable tablets. Many times just a cream behind your knee. The best are the pellets for my women. For you,
right.
Now, again, in about 3 months, Mary, I put a pellet in her every 3 months in her hip. And again, that releases testosterone slowly. And so when she gets run down, I check her adrenals. Your adrenals are 2 little glands above your kidneys, the size of your thumbs, and I can press on her 11th rib and it hurts like the dickens. I say, oh, that's your adrenal gland, your adrenals. And you guys, right here, you'll have pain. And a lot of you go to your doctors, you have pain on your 11th rib right here, the lower rib, and it hurts like the dickens, and you wonder why. Because you got adrenal fatigue. You press on that rib, the 11th rib, and it hurts like the dickens. Your doc says, I don't know, let's send you to get an x-ray, send you to a chiropractor. No one fixes it. It's because your adrenals are exhausted. That's a sign.
Yeah.
That's your sign.
It's amazing how many women over 70, Dawn puts on testosterone and they spring back
And
with
an adrenal
energy.
rebuilder. When I do these two
I'm
and get
telling
them
you,
sleeping,
They're like,
amazing.
I'm alive again.
Now, okay,
Yeah.
so again, testosterone's amazing. Also, progesterone for my women, not for men. Men, please don't take progesterone. It's got to be the micronized progesterone or the natural, just a low dose now, not too much, 100 to 150 usually. It helps my women sleep like babies. It causes nice thick hair. It makes them less grumpy. The women and the men especially says, this is the best thing I've ever seen to prevent her irritability and grumpiness. But also it recharges adrenals. Progesterone and testosterone and an adrenal rebuilder is amazing for my women. Now, adrenal rebuilders, here's what we use.
Okay, before you do that, because Susan Summers recently passed, and this is getting
Suzanne
a lot of
Summers,
attention right now.
She was on estrogen.
She did hormones and natural hormones, and I think we need to address this.
Okay,
So
I knew Suzanne Summers, and I'd see her at the meetings,
Right.
and Suzanne Summers took estrogen. She took estrogen because she wanted to be a young woman. And again, she
that
had
was a
breast
concern
cancer.
of Dawn's,
Yes.
and that estrogen is what feeds the breast cancer.
Yes, it
So
does. And
that's
you got to
what-
turn that off. And so what I do for those patients who've had breast cancer, I put them on, I don't use estrogen at all.
The thing is, the point is,
But here's what I use, Mary.
testosterone prevents
Yes.
breast. I mean, it helps.
Mary, let me
Go
just
ahead.
finish
Okay.
this. I use
think
a
it's important.
testosterone pellet that contains anastrozole, which is an estrogen blocker. So you get the benefits of testosterone, but it's not going to aromatize or convert to estrogen. So in those women, I have a lot of women I've done this for. And again, with Suzanne, she wanted her femininity. She liked the way what estrogen did for her. But again, that is an accelerant or a fuel for most breast cancers. Not all breast cancers, but most of them. Most are estrogen receptor positive, and many are progesterone receptor positive. So for those women, I don't dare use estrogen or progesterone.
Turn it off.
I turn it off, and I give them that testosterone. That testosterone is amazing.
And the testosterone acts, this is what it does not promote breast cancer. That's what I want to make the point.
No, Dr. Rebecca Glazer has done a lot of research on this, and she's done pellets on women with breast cancer with anastrozole and without, and she's literally seen these tumors regress. It's absolutely amazing what it does, especially when combined with DEM, diindolylmethane, or when you combine it with anastrozole or Arimidex, which is an estrogen blocker. So again, you get the tremendous benefits, but you keep the energy. But high dose estrogen blockers cause a lot of bone and joint pain, and so you don't need a whole lot of that. You just need a little bit usually with it, okay? So, adrenal rebuilders. These are supplements that help to restore the adrenal glands. And I've been using these for 30 years in patients. We have our own, which is now Divine Health Adrenal Booster. And most women can take just one in the morning, one in the early afternoon, or men may need 2 in the morning, 2 in the early afternoon. It has this powerful grass-fed bovine adrenal extract that helps to restore the adrenal, support and eventually restore adrenal glands. If you can overcome your worry by casting all your cares and sleep. You got to have those too. And usually, again, if your testosterone's low, you got to support healthy testosterone levels. Other natural adrenal rebuilders that women can use, 2 that I've used over the last 25, 30 years, are adrenal desiccated by standard process. You can get it online. For women, it's usually 2 or 3 in the morning, 2 or 3 in the early afternoon, or Drenamin. There's a double strength Drenamin now, and usually 1 or 2 Drenamin in the morning, 1 or 2 at noon. Another that I've used over the years has been NutraWest DSF or De-Stress Formula. For men, it works great for men. And again, it's usually 1 to 2 in the morning, 1 to 2 at noon. Some men need 3. Now, again, that's why I came out with my own adrenal rebuilder, because this adrenal booster is powerful. It has what these other supplements has, but a higher dose generally, and it has the pantothenic acid that the adrenals need in high dose to restore the adrenals. And then another thing that I commonly use for adrenal fatigue is the Myers IV. Now, those that have severe adrenal fatigue, the Myers IV is simply IV B vitamins, vitamin C, magnesium, and calcium given IV once a week, and then I usually follow that with a glutathione IV. Glutathione is the master antioxidant. When we give these 2 together, it's amazing how it helps the adrenals, and it helps to decrease inflammation in the body.
And if someone's had COVID,
oh, amazing what it does for COVID.
You need this Myers IV to help
Myers
you
with
fully,
glutathione. Myers and then a
fully
glutathione.
recover.
Exactly. Now, for those people that are just extremely fatigued, I do what we call the cortisol saliva test, where we do a saliva test for cortisol at 8 a.m., 12 noon, 4 p.m., and 8 p.m., and sometimes midnight. And we check those cortisol levels. We should have a diurnal rhythm, and the cortisol should be the highest in the morning at 8 a.m. It should shoot up high, and then it should taper off and be the lowest at midnight.
Is that what wakes us up? When
yes.
the cortisol goes up, it wakes us up?
That's why so many people most people have heart attacks Monday morning at 8 a.m. because that's when our cortisol spikes.
Wow.
And that's when your blood pressure goes up, your blood sugar goes up on everyone, 8 a.m. especially every morning, but especially Monday morning.
Is that from your fasting?
No, that's how God designed us.
Oh,
and
wow.
so literally our adrenal glands spurt out a lot of cortisol at 8 a.m. And that's why it raises our blood pressure, gets us up. That's why people just wake up and they have more energy and their pressure is high and their sugar goes up.
That's crazy.
Diabetics say, why is my sugar always high at 8? I say that's how God designed us. Because cortisol goes high and cortisol raises your blood sugar up. So it gets us going, it gets us energized, see?
Wow.
And cortisol, small doses are great for the brain. It helps us focus and concentrate. But when we get low cortisol, that's when our energy just goes. Too much cortisol it degenerates our hippocampus, our short-term memory center in our brain that communicates with our prefrontal cortex that shuttles short-term memories into long-term storage. So too much cortisol is bad. Just the right amount is the right amount. Now, there was an endocrinologist, Dr. William Jeffries, years ago, wrote a book called Safe Uses of Cortisol. I read that book 20 or 30 years ago, and I've been using low-dose hydrocortisone in those patients with severe adrenal fatigue. And when their cortisol levels, when I check it at 8, noon, 4, and 8 p.m., when it flatlines and they don't have that diurnal rhythm where it spikes in the morning, then I know that their adrenals are exhausted. They don't have Addison's or adrenal insufficiency. They have severe adrenal fatigue. And so I put them on physiologic doses of hydrocortisone or bioidentical cortisone, which our body makes. See, just like thyroid or just like testosterone, we do the same in those with severe adrenal fatigue with hydrocortisone, and it literally is a life changer for a lot of my chronic fatigue patients. Not everyone, very few need this. The ones who only have a handful of patients own it, but it's been life-changing for these patients. So again, but that's rare. That's not the common thing. Now, let's talk about insomnia, because you can never overcome fatigue without overcoming insomnia.
Yeah.
And so again, I'm going to tell you how we do it every night. To overcome insomnia, what I do, and I used to be an insomnia. You remember that? I used to be a worrier. When I overcame worry, I overcame insomnia.
I know. He would take every patient's problems
to
bed with him.
Pray about them, think about them, take all their problems.
Trying to figure out what to do,
to
what
get
do
them
they
healed,
need.
before I go training,
and this
to
is true.
Burn myself out.
He has spent thousands and thousands of dollars traveling around the world, going to seminars. You have no idea.
For one patient with a problem, I cannot figure them out.
Figure it out.
I couldn't figure it out.
And he'd go, no, Mary, you don't understand. They're having this seminar. They're addressing
across the world.
Mold, the
mold
problems
toxins.
with mold and mold toxins. And I've got a patient. I know they've got this as the problem. And I think the answer is in this seminar. And folks, I have heard this through the years. You have no idea, which I'm thankful for. I'm glad God has supplied all of our needs so that he could do this. But I want you to know he has been a dedicated researcher to find the real answers.
Now, let's talk about the main cause of insomnia. Number one, too much stress. Too much stress creates a hyperarousal system. It activates the hyperarousal system in our bodies, and our adrenals pump out cortisol. So when you're going to bed, you're watching the news, and you hear all this bad news of all the wars, rumors of wars, all the stuff going on, all the murder. See, news generally doesn't have good news because people want to hear the bad.
I know.
And so 90% of the news is bad news.
I keep turning on the news just hoping that it'll give me something.
You can't. That's not good news. So what I do is I take small doses on my phone.
It's always bad.
I'll look at Breitbart, sometimes Fox, just a little bit, just a little dab, just a little dab will do you. That's it. And that's it. And I shut it down because most news is bad. It activates the hyperarousal system in the body, and the adrenals respond by squirting out cortisol. And cortisol keeps you awake at night.
I think, and what's happened is the people at the news media who are behind all this, we're addicted to stress.
Exactly. What happens, and you just hit a major thing, people get addicted to like Fox News, Newsmax,
CNN,
and what they do is they just recycle it every hour. I used to listen to this stuff, and now I listen and I laugh, and I say, they're recycling the bad news. Our cortisol is going up, and we're addicted to high cortisol because it creates a hyperarousal state. And then we can't go to sleep, and then we're thinking about it and worrying about it, and it just activates the stress response in our bodies.
I remember my son Kyle, saying to Donna and I one day, he just looked at me and my dad, and he goes, Mom, no, you and Dad are addicted to stress.
I know.
If you don't have something you have to do, you find something you have to do. I remember him saying that to me. And then when one day he said to me in the car, he goes, Mom, when everything's important, guess what?
Nothing's important.
Nothing's important. And those words went through my head because we make everything about everything. And it's just,
so here's
healthy.
What we do.
That's not healthy. Don't do that.
To shut down this stress response, here's what we've got to practice doing.
Okay.
Number one, get in God's rhythm and learn to hear the voice of the Spirit. Number two, get regular exercise daily. What I like to do is at the end of the day, I go to the gym and I burn off those stress chemicals. Now, Mary, you say, why do you have to go every day? I don't go every day, but I go Monday through Friday because I burn off those stress chemicals at the end of the day.
No, I get it.
And that's why
you don't hear me saying that anymore.
Make it a habit to go to the gym to burn off the stress chemicals.
I know.
Number 3, you want to get 10 belly laughs a day. Now, when do I get mine? Throughout the day, but also at night.
Well, you get them with your patients.
Oh, I get them with my patients all the time.
I'll be back in the office.
We're laughing and carrying on.
I'll hear laughter like crazy coming out of the exam room. And I'll go,
we have testimonies.
They are having the best time.
We do. I have a great time with my patients.
You do.
But here's a good way to get your belly laughter. At night, go to bed at night and turn on Amazon Prime. Has some good shows. I love Frasier. We just started watching Frasier. It was made like 40 years ago.
Yeah,
he's a funny psychiatrist.
This is before things
hilarious.
got dirty and woke.
Yes,
and all
he's
that crazy.
hilarious. Frasier's one of my favorites to watch.
Funny.
He's just so funny because he's got so many problems in his life. He did his own radio show helping people solve their problems, and yet his life is a total mess. And his brother's a psychiatrist in town that's renowned. And just listen to these guys. It's hilarious. Another is Psych.
Yeah.
Psych, Psych, and Psych is a detective, and he has people to believe he's a real psychic, but he's a con man.
Yeah, he's
he
not a
is
psych.
Hilarious. You'll get your belly laughs almost guaranteed. Also, Monk is really good, and Monk has got
some
OCD.
Of the old movies are, if you need something to just get your mind off things, to be entertained, this is safe.
Turn the news off. Turn that news off. Also, be careful because I'll be watching a football game at night. It creates that hyper-arousal state, especially if my team loses and I'm ticked. So again, I just many times will record those and watch them the next day early, the next day in the morning, real early. But again, what we want to do is turn off the bad news, don't watch action movies at night. You get your cortisol level raised. And I love to watch The Chosen. That's a great series, Mary. And then what happens right before I go to bed, I like to watch The Chosen. Then I can if I awaken, I replay it in my mind. It's just a wonderful, it's about the life of Jesus. And you can watch that on Netflix or Amazon
I love the
Prime.
way they did the movie, the movie or the series Chosen. They just make Jesus as a real human being with real issues. And people don't think about that. They think he walked around going, look, he did not do that. He was a real human being with same kind of temptations and frustrations that you and I all live with. And I love the way they've portrayed that. That's really good.
Right. Now, we're out of time, so I want to go through a few things, Mary, that'll help them. We have our new supplement come out, Sleep Ease, Divine Health Sleep Ease. And that's simply a supplement that contains wonderful nutrients that help people sleep, such as GABA. What I did is we have 8 key nutrients that help people sleep. Some are nutrients, some are herbs. It contains GABA, 700 milligrams, which helps people fall asleep.
Now, I have to tell you, you don't want to take it before you drive a car or machinery.
It makes you sleepy. It's a powder.
You only take this when you're ready to go to sleep, because that is exactly what it does. It's so funny. One of our employees,
when we got it in, he said, I got to try this.
He wanted to try it. It was 2:00 in the afternoon, and he goes, within 30 minutes, he was like, oh no, what have I done?
He went to sleep.
He wanted to go to sleep. All of a sudden, he was exhausted. So he was like, I have to get some coffee in me. And he was like chugging down coffee to wake up. Trying to keep awake.
Okay.
He came to me and he goes, Mary,
this
works.
It really works. But it's our new Divine Health Sleep Ease. Amazing. But it has 8 key nutrients, including GABA, 5-HTP, magnesium glycinate that gets in the brain, relaxes your brain, L-theanine, ashwagandha, but not regular ashwagandha, the KSM66, the best kind of ashwagandha, 350 milligrams, a good dose. It has a little melatonin, 5 milligrams, lemon balm extract, which is amazing at turning down stress and cortisol, and it has L-lysine that also helps with stress and cortisol levels.
Now, we suggest you not mix our sleepies with any other sleeping pills.
Don't. Just start. And
That's
do not
it.
overdo
Start.
it. Just one scoop.
Yeah.
Or if you're older, just start with a half a scoop.
Yeah.
This stuff works really good.
Don't want to mix this stuff together.
And for fatigue,
right.
Mary, we got to mention our Brain Zone Focus, this stuff, along with the nanoglutathione 4 sprays a day, and our Adrenal Booster are the key things for energy and overcoming fatigue. And then testosterone, remember, get your testosterone checked and optimized. And then if you need it, testosterone boosters or testosterone zone is our testosterone booster, 3 in the morning. It helps young and old, but many men, especially over 55, need the actual testosterone in shot form. Shot form is the best, or pellets, especially for women.
Be sure and go to our website, divinehealth.com, drcolbert.com. Partner with us. We buy our products. You become a partner with Dr. Colbert. We thank you for watching. This was Energy Part 2, and I believe we're going to have...
Fatigue Part 2, Mary.
Fatigue Part 2.
It's restoring your energy, but it's overcoming fatigue. Okay.
Overcoming fatigue. But anyway,
yes, part 2.
That's Part 2. So we've got Part 3.
3 and 4, because I'm only halfway done.
Oh, my.
We got 2 more. I was wanting to do back pain. We'll do it next time.
Okay, well, stay tuned because we've got more coming. Thank you. God bless.